Okay.
All right. So, Yashikayach, Mark, thank you so much for joining us. We're here with Mark Abrams, Choshva member of our shul and a proud new Zayda.
Hey.
So, mazel tov to the whole Abrams family, to you, your Rebbitzin, and your beautiful mishpacha.
Thank you. Thank you.
So I wanted to discuss, get a heads up both for myself and for the community, to begin to understand the vaccines that are coming out, what we're dealing with. Should we be getting the vaccines? Are they safe? There's a lot that's going on and a lot of words that those that are in the know are speaking about, and many of us are unfamiliar with. So Mark is going to be helping us out with that. And before I start asking Mark any questions, if you could just fill us in on your background in the creations of drugs and vaccines before we start getting into the nitty-gritty.
Okay, very good. So I have attended veterinary medical school back in the 80s. And from veterinary school, I did not practice with large or small animals. I went right into laboratory animal medicine. So I have a little bit of experience with infectious diseases, primarily from laboratory animals, obviously from rabies to dogs, that sort of thing, psittacosis, diseases from birds to humans, and obviously laboratory animals. So a lot of monkey diseases, encephalitis, that you have to use animals for preclinical models before you go into humans. And a lot of these animals have diseases that are dangerous to humans. So I work with those and have a PhD in biochemistry and a second doctorate in immunology. So that's my background. I have 26 publications. You can look me up on Google Scholar if you're interested. And I have 32 patents with Pfizer. I worked for Pfizer as a research scientist for 26 years, developing new pharmaceuticals and working on vaccines with them. And I worked on a protein called CLF is an acronym. It was used in vaccines to actually enhance the immune response so that the vaccine would work better. So I worked on that for 3 years with Pfizer. And many, many drugs that you're familiar with: Viagra, Lipitor, Celebrex, and some cancer drugs. But been on those teams for many years. After Pfizer for 26 years, I went to a company called Eurofins and did regulatory work there on all new drug development with the FDA. So I have a little bit of understanding of the regulatory part of this also. So that's pretty much who I am. Okay.
So we keep hearing about company names. Pfizer just rolled out a whole vaccine. We know about Moderna coming out. There's other companies as well. Are all companies creating the same vaccine? Are there differences between the vaccines? What's going on?
Okay, good. So there's many companies working on vaccines right now. The United States government has backed 6 companies with $2.5 billion, what I understand, for each of these companies, which for production of the vaccines before they ever came to market, which is unheard of, but that's part of the warp speed that they're doing. So basically for these, they backed 6 companies for 3 different types of vaccines. Pfizer and Moderna are the first ones coming out, and those are what we call messenger RNA vaccines. I'll explain that in a second. And the second 2 groups, I think it's AstraZeneca and Johnson & Johnson. Theirs are typical, used for many, many years, what we call attenuated vaccines. Attenuated vaccines are vaccines that have been, the virus itself has either been killed or damaged in such a way that it can't cause disease any longer. But, and that's why they're safe. And we've used that for measles vaccines. All the vaccines since we were children, primarily that's what they are these attenuated vaccines. In the last 10 to 20 years, Pfizer and probably many other companies started working on even safer vaccines, which are what we call peptide vaccines. So instead of injecting the entire vaccine, entire virus into a person to get an immune response and create a vaccine that way, these are small portions of those viruses that the body makes an immune response to them. And since they're synthetic, we make them in the lab. We can make them pretty quickly, and they're very safe because they don't have any of the disease forming components. So that's the last 10 or 20 years. That's a new thing. And so 2 companies for those, 2 companies for the attenuated, and the 2 recent ones are coming out of the messenger RNA.
Right. So which companies, do we have names of the companies that are creating the peptide vaccines, this 3rd category?
Yeah, so I don't know them offhand. I know they mentioned them, and I just don't remember who they are. But they're you can look it up on the internet. Those are
okay. And I'm assuming that all 3 categories of vaccines come in and impact the immune system by hitting different parts of the DNA of a person. How exactly are these vaccines effective?
Okay, so let's say, just for an example, if you have a virus particle, it has a protein coat, and when that protein coat is injected, coughed, sneezed, inhaled into a human being, the body has an immediate immune response to that. Okay, that immune response, it goes in 2 ways. We have what we call a B cell response and a T cell response. So the B cell response is primarily what makes our antibodies. Okay, the T cell response, or the humoral response, that's more your memory cells and your inflammatory response. So the inflammatory response is how the body will actually go in and destroy that virus. That destruction could also cause illness to us. You can have an over immune response. It's basically inflammation. It's what, in simple terms, would be like pus. Okay, you have neutrophils, monocytes, macrophages, all these cells in the body that are the army that goes in there and destroys that vaccine. So the B cell response is the first response that actually creates antibodies. Now, antibodies are your main soldiers in this. In that, I shouldn't say main because they have an important role, but the antibodies are what actually attaches to anything foreign that comes into your body, whether it be a virus or a bacteria infection. Throughout your life, you're exposed to many, many foreign things, and to everything foreign that comes into your body, you have an antibody response to that. The antibody's job is to bind it and then elicit maybe more of that T cell response so that you get the gobbling up and the chewing and the destruction.
Gotcha. So this is really 3 different approaches to create antibodies against the virus.
That's correct. Or an immune response. That's correct.
An immune response. If a person already has antibodies, is there any need for them to get a vaccine? Is it helpful?
That's a good question. So what does it mean to have antibodies? So all antibodies aren't equal, and all binding of antibodies to the foreign object is not equal. So what you need is a tight binding antibody. So for an antibody to bind to a part of a protein could be 1,000, 10,000 amino acids. You need 7, 8, 9, 10 amino acids as a binding site for that antibody to bind. Okay, so to make it simple,
I feel like I'm in class. I'm waiting for you to start speaking in English. Go ahead.
Okay.
No, this is great. Keep going.
Okay, let's look at it as, instead of amino acid sequence, let's just look at green, yellow, blue, and red, or something like that. All right, those are areas around, they're proteins around that, amino acid sequences around that virus capsule coat. Okay, and antibodies have to bind to those. So what you need is an antibody that's going to bind tightly 7 amino acids to 10 amino acids. If you have an antibody that binds to only 3 of those, like a small part of the yellow or a small part of the red, you'll get a response, but maybe it won't be that strong. You need a strong binding, strong, tightly binding, so that it can start chewing this up and destroying it. Mm-hmm. Okay. The other thing that you need is a high titer, a lot of antibodies. So if you get small titer, you'll have a defense that maybe doesn't last so long or it's not that strong. So you want high titer. High titer means a lot of antibodies, and you want them to bind tightly. And all those things may affect the longevity of this, right? So how long is that antibody going to stay in the body? We don't really know. They're all different, but we do know that the tighter binding ones and the higher the titer, the better chance you have of having a longer response. So how do you get that, right? One thing is when you have the T cell response, you have to make what we call memory. So these are cells that are floating around in your body all the time. You've been exposed to, let's say, the flu or any kind of virus, any kind of bacteria infection. You have these memory cells that float around the body. They don't do anything. They're just hanging around throughout your entire life in most cases. And when you're exposed a second time, they remember, oh, I've seen this guy before. I already know how to make these antibodies. Let's get to it. Bring the army in. Let's go. Let's start killing them now. And so you get an immediate response.
And that's the idea behind the two stages of the vaccine. I got you.
The two stages, that is two stages. What we do when we immunize somebody, a normal immune response takes 21 days for first exposure. Can you see my hand? So your response goes like this. It takes 21 days. As you're going up the graph here, you're making more and more antibodies. At 21 days, now the body's primed. It's seen this. It's got the memory cells going. All the inflammatory responses are ready to go. We hit them with a second injection, and that response goes straight up. So in terms that you've heard on the news recently, the first two, Moderna and Pfizer, they have an efficacy of about 95%, which is really kind of unheard of. That's just great at binding them and killing them. It's a huge response. Normal vaccines, if you have a good response, would be 60 to 70% efficacy. And a lot of times you can get that in that first response, right? But to get to really the true 90, 95, it's hard to get. And if you get it, it usually takes a booster to push that immune system out of this phase into like a log phase.
Right. So even if somebody's testing positive for antibodies, they have antibodies, right, there's no way to know from that test the level of tightness that the antibodies have.
That's right.
And therefore, it would still be worthwhile to go through with a vaccine, right, to ensure that your body is prepared and immune. Now,
not only tightness, but and memory. We have to have memory. And memory.
So if there's three different styles of these vaccines,
right,
would a person go and get all three?
So that's a good question. I'm still worrying about that myself. I don't think so. I think if you have a efficacy from Moderna and from the Pfizer that is up at 95%, I think your shot and your booster should be enough. You probably never need it again. We don't know. They're brand new. Messenger RNA vaccines have never been marketed. A lot of people are working on them because they're so easy to make and so quick to make, but we don't have the history yet to know how long they last in the body. So
gotcha. So there's really no way to know that which one of these three is going to bring out the best response.
Right. You have a good response, but it may be an immediate response. It may only last you 2 or 3 months, maybe a year. Okay. Everybody's kind of betting on it. Like the normal flu, every year we go in and we get a booster and we do it again. There are things like measles. You get a measles shot maybe once in your lifetime and you have memory that lasts your entire life. And you don't have to get a measles booster. Tetanus, sometimes it lasts 3 years or 5 years. People get a booster for a tetanus shot after a shorter period. So it has more memory, but maybe not a lifetime memory. We don't know for this one. It's kind of new, how much memory we're going to have, how long it's going to be around. So in a year's time, you can go get your titer checked if people are giving titer tests, and that tells you how much antibody is in there. And if you still have a huge number, a large titer, you don't need to get a booster. You're good to go. You're ready to fight.
Right. Now, a big topic of conversation is, and just to put it frankly, people don't want to be the guinea pigs, right? We don't want to be the first ones to take the vaccine and without any long-term knowledge of what are the long-term effects of this vaccine. How confident are we that they're actually safe? And I'm going to add on to that question. Have the studies been done, even short-term, on all age brackets?
So no, they have not been done on all age brackets. They're actually starting that now for all different types of, they're doing more studies. They're having trouble getting African Americans to come in for the test, so they need more of those to come in. For the age brackets, they're doing studies. It's, again, hard to get people to enroll in the studies because you're a guinea pig. So it's hard to get younger, to bring your kid in and say, let's use him for a trial. You know,
right.
People want to do that, but maybe it needs to be done. We don't really know for sure if it's really necessary for them, or there maybe.
So who have the studies been done on, and what about the long-term effects that many people are concerned about?
Right. So for the messenger RNA ones, the Moderna and the Pfizer, they're brand new. So nobody knows the long-term effects. What I can tell you, and again, you know, everybody has to talk to their own doctor. That's really what your doctor recommends. You know, I'm not going to go against that. But unlike most clinical trials that I've been involved in, we've been lucky to get 5,000 to 10,000 people in third phase clinical trials to be part of these trials. These have 60,000 in each one of them, 30,000 placebo, 30,000 test subjects. That's a huge number. And so if the FDA says that these are safe in 30,000 people already, you can assume that they're going to be pretty safe in the general population. There are always going to be some people that have an overactive immune system. They're going to be allergic to maybe something that's in the filler of the vaccine and the liquid that they give it to you. We don't really know. And long term, we're not going to know for 10 or 20 years. But you have to weigh that against the danger of actually getting COVID and how serious the consequences could be if you have comorbidities or if you're older, you know. So that's an individual choice or choice you need to have with your doctor. But so far in 30,000 patients for each one of these, Moderna and Pfizer, they've been proven to be safe. So that's safe now, short term, versus long term, we don't know. And again, you have to weigh out individually that against the danger of really getting sick or dying. You know, some people just have no symptoms and they don't get sick. And some people really do. We have a lot of deaths from this one. So,
would you, I mean, for what I'm hearing from you is that you would recommend the vaccine to people, certainly if they're high risk of COVID.
Right.
You would recommend it to people who are of average risk. Low risk, you're unsure about. But here's the question: if there's enough people who don't take the vaccine,
right,
even if they're low risk, does that remove the whole purpose of the vaccine, which is to get this out of our society, you know, with the help of HaKadosh Baruch Hu, obviously. But if there's enough people in the age bracket saying, you know what, we haven't taken it, we're not going to take it right now, and we're going to take our chances because, you know, we don't really have much of a risk, like you said, with children or whatever. If there's enough people who don't take it, does that ruin everybody who has taken it? Does that mess everything up? Or do we say now they have strong antibodies, so they're going to be fine anyway?
Right. So I think that's a big unknown. But if you have half the population that does take it and the other half doesn't take it, they're not really hurting the ones who did take it. Now, maybe since they have it, they can give it to the ones who've taken the vaccine, and maybe they can get sick a second time, right? But again, with a 95% efficacy, you have a pretty good chance of never getting it again, okay? So they're only hurting themselves if they don't take the vaccine. That's my opinion.
I mean, even with the virus going around, if I'm vaccinated, I should be okay.
You should be okay, right? And if they don't want to get vaccinated, it's their choice. They're not hurting anybody else. They're just going to hurt themselves and the other ones who didn't take the vaccine. So eventually they're going to get it from each other, and they're going to get a titer anyway, or they're going to die, right? Or they're going to get really sick and they're going to get a titer, whatever it is. They have to run that whole gambit of the illness. So it's a decision. If you're afraid and you don't want to take it, you run that risk of actually catching coronavirus and getting sick. If you're maybe a teenager or a young man or a young person and you're healthy, maybe you don't want to take it. Go ahead, give me the virus. I'm fine.
Right.
I'll get it. I'll get sick for a few days and I'll be fine. That may be, but if you're older and you have comorbidities, you probably should take it. And that's
Gotcha.
why, or if you're around other people that you could give it to, if you're a health worker, a policeman, a fireman, you probably should take it. And that's why they're getting it first. And then they're going to the nursing homes and they're giving it to those people second, then comorbidities third, and then the general population will get it after those people. So it's
Gotcha.
it's a gamble. You decide on your own, But
Right.
Again, I understand the fear, but we've done vaccines for many, many years for many, many diseases. It's what we have. How do we fight these guys? It's what we have, and it works. Years and years of proven history. This is new, and I can understand why people are afraid, but for new, it's one of the best ones we've ever had. That's the Moderna and the Pfizer. We just don't
So
know.
if there's any message, besides for any questions that I asked you,
Right.
if there's any particular message you would like to give myself or anybody watching in or listening in, what would that be concerning these vaccines?
I would take it. In fact, I signed up for all three different clinical trials, and I was accepted for all three. I was first in line, ready to go, and volunteered to do some of the research while they're doing it. They wouldn't let me do that because it's a conflict, but they eventually turned me down because I had recent surgery, and you have to be 6 months surgery free to be on a clinical trial. But yeah, I would take it. I will take it as soon as it gets there. My mother's 93, and I can't wait for her to get it so I can get her out of the home and bring her to my house and let her enjoy Shabbos here with us. So yeah, I would recommend taking it.
All right.
I would take it myself. And in fact, I can't wait to take it. But what can I say? I understand the fear. I understand the fear of the unknown. It's something
You make it sound like it's ice cream or something. I can't wait.
Well, they've been
Fair enough.
We've had a lot of success with viruses in warding off diseases all over the world.
Right.
So
Okay. Yeah, Shakov, thank you so much.
Sure.
Okay, really, really appreciate it.
Let me see if I have a few more things.
What's that?
Yeah. So I guess another question I really don't know the answer to, but I think it's an important question is if you've been exposed and now you have an antibody titer, do you really want to take the vaccine or do you need to take the vaccine? And again, we don't know how strong a response you have. And so it wouldn't hurt to take the vaccine and see if you can get a stronger response. Maybe by not getting the vaccine, you only got up to a 60 or 70% efficacy. We don't know that. So if it's not going to hurt you, take the vaccine. And I don't think it's going to hurt you. Again, you need to talk to your own doctor, not to me. I'm just giving you the science behind it. We have a long track record with vaccines that are successful. So I would say go for it.
Okay.
Okay.
All right. Thank you so much for your time.
My pleasure.
Really appreciate it.
And stay safe.
Amen.